Good morning, everyone. Happy Wednesday. Good morning or good afternoon for those who are tracking us on the live stream. It's my pleasure to moderate this panel with three leading neuroscientists on a very important question about how are our little ones doing after a little bit over 2 years in the pandemic. And let me start with going back to the Spanish flu and what we know about the Spanish flu and its impact on little ones. There is a researcher at Columbia University that actually had tracked the impact of the influenza and the pandemic on kids longitudinally between 1918 and 1980, and observed that kids who had been exposed and were born during this period of 1918-1919 were 15% less likely to graduate from high school many years after the Spanish flu was over. And similarly, those same kids that in that cohort that he had tracked were 8 to 12% more likely to be on social benefits during their lifetime. The effects were twice as much for children who were non-white, so massive effects from the Spanish influenza many years ago. And so when I heard about the work that Dani, Phil, and Sean have been doing, I think this is one of the most important set of data that researchers are tracking right now, which is, what do we know? How is this impacting our little ones? And more importantly, what can we do today to moderate and mitigate and alleviate some of those concerns that we know will likely occur? So with that, I was going to ask each one of my three brilliant panelists to speak about not only their research, but also more importantly, their early findings. And you will see that each one of them has actually adopted very different methodologies to track the impact. And I will ask Dani first to speak about she has one of the largest cohorts of babies and moms that she has been tracking since the onset of COVID in New York City, where, as you may remember, 2 years ago, this is really where the pandemic started to explode. So a really fascinating cohort that she has been tracking.
Thank you. Thank you so much, Isabelle. And it's really wonderful to be here. As a neuroscientist, you never get to kind of be on a stage and just talk. It's really exciting. So I'm Dani DeMetrium. I'm a pediatrician and neuroscientist at Columbia University. And I have to start my story with the fact that before March 2020, I actually was a super happy neuroscientist in a lab working on rodents, working on mouse brains and rat brains. But I also spent 20% of my time in the newborn nursery, always considering that to kind of be my time off, my fun part of my job that would kind of keep me going in terms of the hard parts in the lab. But in March 2020, I was thrown into this whole new world of coming into the hospital, which was changing on a moment-to-moment basis, coming to patients, to moms who were really scared. I became the COVID attending during that time. So for most of March and April in 2020, I was a COVID attending in the first nursery to really be hit hard throughout the United States. And the whole country was looking at us for answers, for policy changes. And you know, these patients were asking us, okay, what's going to happen to my baby? And for all we knew, they could come out with two heads. We had no idea what was really going on. And that's when I also turned to some of the literature, and as Isabelle mentioned, the 1918 Spanish flu was really influential in my thinking. And some of the interesting data that Isabelle just mentioned, actually at that time, there was no way of knowing which ones of those babies were exposed in utero to the virus versus which ones of those babies were exposed just to the incredible societal changes that were going on. And so, we very rapidly mobilized at Columbia University. I really sit here on behalf of a very large group called COMBO, the COVID-19 Mother-Baby Outcomes Initiative at Columbia University, where we now have over 100 researchers, clinicians, volunteers, trainees that have signed on to this initiative and have contributed to a massive amount of data that we've collected for this cohort. We now have enrolled over 1,300 mother-baby dyads. That's 2,600 people across primarily New York. So about 1,000 of our dyads are in New York and a couple hundred from Utah and Alabama. And I'll just tell you very briefly, and then we can go into it a little bit more afterwards. One finding that we've just recently published in JAMA Pediatrics that came out in January, which was our first look at the neurodevelopment of these infants. And in particular, we asked the question, will maternal COVID-19 disease during pregnancy have an effect on the baby? And that's because we know from numerous other viruses and other insults in pregnancy that there can be effects. And we found nothing. And we were like, yay, we're going to publish this finding. This is so great. We had really detailed data in terms of their disease. But then we said, well, you know what? We have this other cohort from before the pandemic. Their babies born at the same hospital. They were evaluated with the same methods. Let's just quickly look before we submit this paper. And what we saw was really, really striking. We saw very significant differences with lower scores in fine motor, gross motor, and personal social domain on the babies born during the pandemic, independent of maternal disease status. And I'll leave it there, and then I'm happy to talk more about it later. Thank you.
Thank you. So I will turn to Phil, because Phil, you took a very different approach. And so speak about the survey and the scale and the frequency of your observations.
Yeah, thank you, Isabelle, and pleasure to be here. Not unlike Dani and Sean, I've historically done a lot of research that's looked at the extent to which children born under circumstances of a lot of adversity experience challenges over the course of development in terms of early learning, in terms of other kinds of behavior, as well as larger kind of health issues. When the pandemic started, our lab shut down, as did much of the world, and we were left figuring out how we could contribute meaningful information given what we were able to do. And what was clear was that with the exception of the small amount of data coming from the 1918 pandemic, there wasn't an extant knowledge base about what households with young kids would be going through and what their needs would be during the course of the pandemic. So we were very lucky to have several funders who supported us to start up a survey very quickly. And so in the span of a couple of weeks between March and April 2020, we got a survey off the ground, and we're very quickly sampling over 1,000 households from around the US, so geographically distributed in all 50 states, as well as very diverse in terms of race and ethnicity and income, to understand what was going to be kind of forthcoming. The survey is taken online. It's called the Rapid Survey. It takes about 15 minutes to complete, and it's available in English and Spanish. And it really paints a holistic picture of what is going on in households. So we ask about adult and child emotional well-being and distress and related areas like family conflict. We focused a lot on the economic circumstances of families, ability to obtain basic needs, as well as things like access to healthcare and childcare. And in a year, we were able to collect the survey on a weekly basis, and then we expanded, or we sort of separated, so we then shifted to every other week, and we're currently continuing the survey on a monthly basis. We've also recently, in the last year, added a survey of the early childhood workforce. What we've been learning, I think, is not a surprise, probably to anybody here, but I think it's very germane to people who are in attendance at this meeting, in the sense that we see that families have, over the course of the pandemic, struggled with issues that are actually long-standing. So we see challenges around people being able to manage the economic stresses of obtaining basic needs. But what we see is that the rates of economic stress are just substantially higher for families with young kids than they were before the pandemic. 1 in 4 families doesn't have enough money on a monthly basis for food. That's 1 in 4 of all families with young kids in this country. And when you look at the early childhood workforce, the circumstances are even more concerning. So we see 1 in 3 early childhood providers that doesn't have enough money for food. All of these things based on the knowledge base that these folks have helped to establish and that we ourselves have been involved in can show a pretty strong relationship and cascading effect between not being able to make ends meet and the extent to which people are able to provide responsive and nurturing care to their children. And then when that becomes an issue, it can really interfere with kids' ability to have kind of optimal development. And so that cascade from basic economic hardship to child well-being is a really important one. It's gotten a lot worse during the pandemic, but it's certainly not something that sort of sprung up immediately. And it's something that we need to continue to pay attention to as people who are concerned with kids' neurodevelopment. We expect that it's going to be showing long-term effects on kids' development in terms of not only their ability to kind of learn and acquire kind of cognitive skills, but also on their social emotional well-being and their health across the lifespan.
Thank you. So Sean, you took an approach that was very collaborative with other universities, with Rhode Island Hospital. Maybe speak more about the great work that you have done.
Yeah, no, thanks. And thanks for having me here and thanks for everyone being here. I think now I understand it's more than symbolic that I'm here in the middle, because I think our study kind of sits in between and straddles between the 2 studies you just heard. But I'll let you know a little secret. I'm actually a neuroimaging physicist, so I'm not a child development scientist, but we have a large child development lab, which over the past 13 or 14 years, we've been following approximately 1,600 families, some other child dyads, from in utero development all the way through now to early adolescence. And we've been continually recruiting since about 2009, 2010. Idea being that we bring in kids, we try to recruit them, as I say, either in utero or in the first 6 months of life. We do neuroimaging, so MRI, neurocognitive testing, as well as a whole host of environmental assessments to understand how the child's developing, the home environment they're developing in, and follow them up at sort of 6 months to 1 year increments. I think it's kind of funny now to think that we're 2 years into this, into COVID. I think when it first started, my first thoughts were, oh man, how do we keep this going? How do I keep my lab going? Thinking that this was going to end very quickly. Unlike many of the other labs, I think across the world for that matter, we never actually shut down to in-person assessments. We had to scale back, but we managed to keep bringing children in, assessing them using sort of usual cognitive assessments, using our neuroimaging tools, etc. And what we began to see, as opposed to having this hypothesis that we would start to see differences, our research assistants and our psychologists kept coming to me saying, there's behavioral changes in these children and these infants. They're just not doing what we're expecting them to do. They're not achieving what we're expecting them to do. They're taking longer on these assessments. They're distracted. And that anecdotal statements became a chorus. And so finally we went and looked at the data, and we began looking at our cognitive measures collected back since 2009 and just plotting those by year and looking at how those trends are. And what we found over the last, looking at all of our kids from 0 to 3 years of age, where we have the same tool, the same instrument, we found from 2000, back from 2009 to 2020, the first half, and then 2020 to 2021, we're seeing about a 1.5 standard deviation drop in the same scores that Dani was mentioning. So fine motor, gross motor skills, as well as language skills. We then cut that up because obviously there's a mixture there, right? Kids who are older would have been seen pre and post beginning of the pandemic. So we then cut that up and looked just at the infants who were born at least a year before the pandemic versus children who were born from July 2020 onwards. So I had at least 1 gestational period during the pandemic. On those children, we're seeing over 2 standard deviations drop in motor skills and language skills. Following them since that time, we're seeing almost a monotonic decreasing trend in those scores in almost all those kids. So they continue to reduce in overall score relative to flatlining and then beginning to improve, as we would hope, as restrictions in the pandemic has eased. Adding to that, we also now have neuroimaging data, which we're now starting to look into and mirroring the cognitive findings we're seeing reduced white matter development. And for those who are not neuroscientists, white matter is the wiring of your brain. It shuttles information throughout your brain, and without it, it'd be very much like having a conversation, whereas I'm leaving words, not filling blanks, right? So without white matter, the conversation is a lot harder. So the fact that that's developing more slowly could signal some long-term consequences. So that's what we've been finding.
Thank you. Obviously very sobering, but that's, I think, what we need to hear more is where are we, and the picture may not be great, but we need. I think this is a very, very important message that policymakers, innovators, parents, everyone needs to hear a lot more. Dani, you had similar but maybe slightly different findings. You focused a lot on emotional connection, social emotional. Can you maybe speak more about your findings?
Sure. So I think maybe what you're alluding to is what might be going on. Why
Yes.
might we see what we're seeing? So while I can't completely answer that question today, because we're still kind of trying to investigate this mechanism for why we're seeing these lower scores, first of all, unlike Sean's findings, ours were actually from Parental report. We are continuing our studies, and we are doing some similar assessments to what Sean's group is doing in terms of actual objective assessments. But these early findings that I just mentioned were from Parental report at 6 months of age. And because we didn't have sort of a good stress measure at the time, especially a prenatal stress measure, but we knew that all these babies were coming from the first wave in New York City. And for those of you that might not know, New York City was very unique because it had a really sharp peak in March and April, and then almost nothing until November of 2020. So we had this like nice moment in time where the pandemic hit New York City, and then this sort of lull in between where we all thought, we're done, similar to what Sean was mentioning. So what we were able to do was to separate our moms into what trimester of pregnancy they were at that peak. And you know, I remember very well what was happening around New York City around that time. We were really in a very high stress situation. So we surmised that, okay, at that peak, which we defined as April 6th, which was the highest daily case rate, that peak was the highest stress. And so we then separated our moms into being in their first trimester, second trimester, and third trimester during that time. And what we found is that the biggest effect, and most of certainly the only significant effect, was for those moms that were in their first trimester. Well, what does that mean? That means that basically something got embedded into the fetal developmental trajectory of those infants. And we know from lots of animal work and other human work that stress or other big insults in the beginning of a pregnancy have a much higher likelihood of embedding themselves into that fetal developmental trajectory. So to surmise, we think that what we're seeing is actually the effects of the stress of the pandemic and not of other social changes in that initial study.
Thank you. Sean, your research actually say something a little different. It says that, or at least my read as a non-scientist, is that it's actually inconclusive, that we can't conclude that parent stress was a factor. Can you explain that and maybe other hypotheses that you may have on the why?
Yeah, I think I want to caution. I certainly agree. There's a tremendous amount of work that's shown the impact of stress on the developing fetus, and in particular, it's also gender specific. It seems males are very sensitive to maternal stress, and that little X chromosome not so great. But I think what we found, because that was the first thing we went to, so it's going to be stress. Let's look at maternal stress. And so we have been collecting a very small standardized measure called the Perceived Stress Index. It's 10 or 12 questions. It's not very overly specific to particular insults or certainly not to a pandemic. It's just general life stresses. So like, are you worried about your job? Are you worried about putting food on the table? Those sorts of things. We did not see any changes in that measure over the last 6 years. And it's certainly when we put that into a model to explain our cognitive findings and our neuroimaging findings, it doesn't pop up. But I don't think that means that it's not an impact. What I think that means is that we have a very select population that we studied, right? So remember, Dani, those were parents who were having children, right, who are being enrolled into a study. Phil, your group is anyone that you reached, right? So probably very population representative. Ours were parents who chose to come into a hospital during a global pandemic, right? So that is a whole different mindset for parents, right? So that's obviously parents who are less stressed about the situation and are willing to bring their kiddos in. We thought then that, okay, well maybe then it's a select group of parents, right? Are these parents who may be struggling, and that's why they're coming in. They need some reimbursement. We don't pay a lot, but we pay a little, and that might be what is the difference. Again, looking across our data, we didn't see a significant SES change, so it's not like we suddenly dropped out or dropped down in an SES or socioeconomic characteristics in the population. But when we put that into our model, and this is based on both maternal education and family income, we see that was a significant predictor, and particularly it was very protective. So higher SES families were less impacted over the last 2 years than our lower income families, which I think makes sense overall. But again, I think the maternal stress was simply related to the fact that we had a biased sample. We were a really specific sample. I certainly think, the other data, both from Phil's work, I think there's a really nice study from Catherine LaBelle's in Canada, similar to yours, I think, showing that by far there's a lot of stress going on for moms, and that's going to definitely play a role. But we just had a weird cohort.
Yeah, very interesting. So Phil, by the way, the Rapid EC website is just so filled with data and charts that are easy to understand. So highly recommend the Rapid EC website for any really interesting, timely, every week data on families. But one of my favorite charts is the one that tracked the number of hardships per family. So hardships being defined as losing a job or losing a family member or other dramatic events in a family setting, and had two lines. One was parent stress, emotional stress, and child emotional stress. And you could clearly see how all of us was connected. But Phil, please tell us more about your findings on clearly this really important question on the importance of parent stress and how it impacted the little ones during COVID, or your hypothesis on it.
Yeah, I think it's interesting because you hear somewhat divergent kind of outcomes, but I think there's a consistent story across all of what we're finding. And I think that is the extent to which families found themselves in circumstances that either were or weren't particularly stressful. The pandemic beforehand, even before it struck, we know that there were large differences in some sectors and subgroups of the population. So single-parent households tended to have higher levels of stress, not surprisingly. Raising a child in these times, trying to find childcare and working, very challenging. Parents with families with a special needs child, also higher levels of stress, greater amounts of social isolation. But what we saw in the context of the pandemic was that really those sort of differences were exacerbated. And so what we saw was a great increase in the variety of areas that people were reporting having difficulty making ends meet, including paying for housing, paying for utilities, paying for food. And there was a very clear direct relationship between the more areas that people couldn't pay for and the amount of distress that they were reporting on their parts, and then how much they were reporting that their kids were experiencing. And so you sort of see this chain reaction. And I think, why is that important, especially from sort of an ed tech perspective? Because I think we can say that not all kids and not all families have been similarly impacted by the circumstances that we've been in for the past few years. But when the levels of economic stress and ability to sort of make ends meet have been consistently exacerbated across time, that's where families are going to need additional supports, where schools are going to need additional tools for helping to support children's learning and to keep kids on track or to get them back on track. So I think it's really in that context, thinking about elevated stress levels for everybody, but then also thinking about in specific subgroups that we should be especially thinking about how we can support families. And there's a piece of that that's not just, I think the other piece that we've learned is it's not just about what are the tools to promote learning, but what are the things around the child. So one of the resiliency bright spots we found is that the extent to which families, regardless of their circumstances, have been able to maintain routines around their children, outcomes are looking better for parents and for kids. Not that easy to do when you're worried about whether you're gonna have housing or not, but clearly makes a difference. If we can't figure out ways in the context of the kinds of programs that are in place to create and promote routines, I think we're going to be under challenging circumstances. But I think we should be thinking about these kind of contextual issues. The other is, how do we make it so that people do have reliable and stable income in order to make ends meet? Not just thinking about how do we promote kids learning, but in the context of promoting kids learning, we really need to be thinking about economic well-being. And I think that startups and ed tech can play a role in that. It's not simply just focusing on the child. It's really thinking about the child in the context of their family and in the context of their community and their larger environment, where I think our returns on investments are going to be highest.
Beautifully said. So one thing that I'm hearing a lot, and it might be a question that some of you have is, okay, parents have been spending a lot more time at home with the little ones. So how come that better relationship or that better, more time should equate to better relationships? And science tells us that better relationships should drive better outcomes. So why not in the circumstances that we are in? And Dani, do you want to?
Well, I definitely want to say we don't know that yet. We don't know what's happening right now. I don't have published data for you right now. And as a scientist, it makes me really uncomfortable to talk about it. But we do have some evidence that things are changing as the pandemic is progressing. And perhaps what we saw in that early study that I just mentioned to you, which really focused on that first wave in New York City, we might not be seeing that anymore. And, for all we know, we might actually see an accelerated rate of development towards the end of the pandemic when parents are not stressed out. So during Omicron, I can tell you that our rates of hospital positivity for moms that were being admitted in labor and delivery was higher, was almost double of what it was during that initial wave in New York City. And yet nobody was stressed out. I mean, people were annoyed because they didn't know that they had COVID and they were coming in and now they were on isolation. But there was nobody, there wasn't that stress, there wasn't that unknown. When I was telling them that their baby was going to be okay, they were able to, accept that knowledge very easily. So it's a very different environment. Now you're combining that with the fact that parents do stay home more often, that there's been a shift in how the workday, even for parents that do work full-time, has sort of changed throughout the pandemic, and we might actually see accelerated development towards the end of the pandemic. But this is why we need to continue to invest in this kind of research and continue to study it.
Yeah, thank you. Shanti?
Yeah, actually, thinking about ed tech, so the one thing that we have seen, so we use, and this is where I could desperately use you guys' help. We use this thing called Alina, which is kind of like the unloved bastard love child of a 1984 Walkman and a beeper, right? So it's about the size of a deck of cards, and the kid has to wear it in their upper chest here, and it measures the amount of language interaction between the parent or any caregiver and the child and back and forth. And in previous work, we've shown that the number of conversational turns, so basically the back and forth interaction between a parent and a child, is strongly related to brain myelination throughout the brain. And that's a measure of white matter development. What we found during COVID is actually, although parents might be staying home more, the actual language interaction with their child is much, much lower and has continued to be. And that's both at the younger infant side of things, but it's particularly true of children 2, 3, and 4 years of age. So whereas before, if we plotted age by number of words from the adult, it'd be a nice linear trend, right? As the child gets older, they're more able to engage and you talk to them more. We found that to be completely flat since the beginning of the pandemic. So basically parents are talking to their 4-year-old as much as they were talking to their 1-month-old. That's linked, although it's not the child's fault. The child vocalizations are the same. They're making the same number of sounds. But so as a result, the number of those conversational back and forth, those conversational turns, are significantly lower. And this is actually data that we just learned that Alina, the company that makes the device, has been doing in the back end, and they're seeing some of the similar results. So although parents might be home longer, I know I'm home longer. However, I also know that I'm on Zoom much, much longer, right? From 6 a.m. until 7 or 8 p.m. And so those time periods where I might have been doing bath time, might have been playing with the little one, might have been going outside for playtime or kicking the ball around or whatnot, those have kind of gone for a meeting. So although we're home more, maybe we're not interacting as much. And so trying to stir that interaction would be, I think, great. I also think trying, because early interaction is the biggest brain builder there is. Right? That's the biggest thing that a child is kind of working on. So spurring that conversation, but also ways of measuring it. I always thought it'd be awesome if you could actually embed like Alina into a bear, right? And then you made it like a pedometer so parents could post it to Facebook, right? You want behavioral change? Like I said this many words to my kiddo today. Like I think that'd be I think this is a horrible idea, but I think it would actually work. But, so don't do that. But, something along those lines and something that's smaller, easier to gauge interaction to help spur that would be great.
I think this is a really particularly powerful opportunity. I think that the extent to which we've seen many fundamental adaptations to the early parenting and early relational environment during the pandemic gives us ample opportunities to think about ways to innovate, to support parenting. Sean, what you're alluding to, my kids are all grown, but being on lots of Zoom calls with people with young children, one of the things that I've certainly observed a lot of is this sort of amazing choreography so that people are still emotionally connected to their children, still responsive, but in a much more intermittent way. But it's still predictable. And so kids enter the screen or they enter the frame, they get some attention and they go off and do their other thing. And I think we need, as people who are concerned with early childhood, to be understanding, not just talking in black and white terms about the nature of interaction, but need to be thinking about the nature of parent-child interaction and of other caregivers, including the early childhood education workforce with our children in what's really a changing world. And I don't think, the other thing I just want to put in a pitch for is that there's a lot of talk about this. It's just super important. I don't think that the pandemic fading means that we're going back to the way things were. And in part, I think it's been a disruptive event in general, but I also think that people are recognizing that there are geopolitical issues that are affecting the parenting environment. There are climate issues that are going to continue to affect the environment. And so rather than think, well, this is the knowledge base that we had, I think we need to be thinking, what is the context in which young children are coming into the world right now? And how do we start designing for that kind of current context that's going to continue to be the case, where unexpected events are going to happen, where it's going to be hard for people to say, I just can keep a regular schedule indefinitely. That's not kind of be business as usual. It doesn't mean that we should just be expecting everything to fall apart in the world of early childhood, but I think we need to be ahead of the curve in terms of adapting for the world that's coming.
So I have many more questions, but we have a few more minutes for maybe one or two audience questions, which I would like to invite you to think about now. And we have a mic here. I see a mic here. So raise your hand if you have a question. Otherwise, I can continue with mine, but...
Sure. Hi, I'm Mary, and so amazing to see the brain power here. I think my hair is melting from sitting so close to the panelist. My question is, I've been observing, these kinds of issues for a while. Stochastic shocks, the pandemic is a stochastic shock, a one-time thing, and it's great for unearthing the causality of brain development issues. So it's great to have that test bed. But then what's really been concerning me is this continuous human ecosystem change. When I was a kid, the telephone, right? And there's been data about 25 to 30,000 words a young child hears in the household. And it's the ambient conversations that they have to do sense-making on. So the telephone, chatting, heads down in the laptop. So these are what I think of as ecosystem continuous changes, and there's a lack of responsive speech. So children sit in front of a recording. There's less of the reading together in the book. I mean, there's some really practical things parents can do. So when you get to some predictive suggestions, how are you going to come up with things that caregivers or parents can actually implement in an easy way in a fragmented household? I mean, it's good to have the efficacy data, but how do you have the impact program?
I'll let somebody else talk about the impact because I don't think I'm the best qualified, but I will point out one thing, which is that not everything from this pandemic is bad, and we really need to focus on some of the good. And I'll just give you a very brief example, which is that in our nursery, moms and babies are actually becoming, in some ways, more emotionally connected because guess what? We're not taking them away from their room. Just by the definition of the pandemic, we had to we couldn't keep them separated just because of wanting to prevent people from getting infected. And so moms and babies actually ended up spending more time together, and we might actually, in some ways, find more emotional connection after the pandemic is over.
I'll just add to that by saying that one of the things that links all three of us together is that what we're talking about in terms of the fundamental kind of mechanisms are things that people engage in on a regular basis every day. And some of the best approaches for supporting children's development are coming by giving people feedback about the things that they're already doing that are promoting healthy development. I think as we start to get past deficit models, the idea that in Dani's case, we're talking about emotional connectedness, Sean was mentioning the language and the kind of back and forth, and we do a lot of video coaching using very similar kind of ways of thinking. Those are core elemental things that are present in every household. And the idea that you can point out those things when they're occurring, bring them to people's awareness, in and of itself can really promote a lot of positive change. And so I think that's, to me, one of the core issues is that a lot of these strategies to promote healthy development in this changing context that I think you so correctly allude to can be addressed with approaches that are very pragmatic and that don't require a vast investment of time and resources in order for people to accomplish them. The thing that this kind of science can do is identify these core mechanisms so that you're not kind of layering all these things on top and creating a really complicated program, but you're getting at the core of things that are really centrally involved in development. And once you've done that, then the product development doesn't have to be all things to all people. It can be a very targeted kind of approach that's really achievable.
And if I could just piggyback on that concept for just 3 seconds, we need more pediatrician involvement and more pediatrician funding so that we can actually promote this, because we pediatricians see these patients the most often, especially in the 0 to 3 range.
Yeah, I don't have much to add beyond what Phil mentioned, but isn't it strange that reading to your child is considered an intervention? Isn't that weird?
Well, with this beautiful, thank you for your great questions. We are out of time. Clearly, I think we all would love to spend a lot more time with these three brilliant minds. I think we'll be outside if there are any follow-up questions. But thank you for being with us, and thank you for being here and for your great remarks. Thank you.
Pleasure. Thank you.
Yeah.